My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
Are you high pitch voice problem?
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this.
Got paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are after treatment live with Akshita, and Akshita was having a kind of voice problem we call dysphonia, and it was due to unilateral vocal cord paralysis, and we did her pre-treatment live on January 28, 2022, and today we are going to do after treatment live. नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट के बाद लाइव हो रहे हैं अक्षिता के साथ। और अक्षिता को वॉइस की समस्या थी क्योंकि इनका एक वोकल कॉर्ड पैरालाइज था, और आज हम लोग ट्रीटमेंट के बाद लाइव हो रहे हैं। और इनका हमने ट्रीटमेंट से पहले वाला लाइव जो है वो जनवरी 28, 2022 को किया था। तो इस लाइव में आप लोग कई सारी चीज़ों के बारे में सुनेंगे और जानेंगे। तो सबसे पहले मैं पोस्ट ट्रीटमेंट वॉइस जो है अक्षिता का कैसा है उनसे बात करूंगा, तो आप सुन पाएंगे। और हम लोग जो है इनका जो ट्रीटमेंट से पहले वाला लाइव है वो भी प्ले करूंगा मैं, तो वो भी आप लोग सुनेंगे। सो फर्स्ट यू विल बी लिसनिंग पोस्ट ट्रीटमेंट वॉइस ऑफ अक्षिता, एंड आई विल बी ऑल्सो प्लेइंग द प्री ट्रीटमेंट लाइव इन दिस लाइव, एंड आई विल बी ऑल्सो टॉकिंग अबाउट व्हाई वोकल कॉर्ड पैरालिसिस हैपन. आई विल बी ऑल्सो टॉकिंग what we do in online voice therapy in case of vocal cord paralysis, and we are going to also talk on what are the other communication disorder for which we have services at our center and how to contact us, and we'll talk about treatment duration and cost as well. So please be connected with us. So Akshita, unmute your mic and just tell us what exactly problem you had, how the problem started, and how do you feel after the online voice therapy.
Hi, my name is Akshita and I'm 11 years old. Actually, the problem started with dysphagia. Whenever I drank water, it would like come out and I would start coughing. That resolved in a few days, but my voice was still low and it would get hoarse whenever I tried to speak loudly. So I started voice therapy in January and my voice has improved a lot since then, and I feel it's louder and less hoarse and less breathy.
Okay, thanks Akshita. I'll be also playing your pre-treatment live, so just mute your mic. And that live we did on 28 January. Yeah, January 28, 2022. So this was the sample.
Hi, my name is Akshita. So on 19th November, I couldn't swallow food, and whenever I drank water, it would just
Yeah. So I want to talk to your mom as well. What is her observation? Yeah, please come. You tell what difference you are feeling in these days. In 28 January, we started the voice therapy, and now today is 1st April 2022. So, what are your observation?
Yeah, sure. Thank you, sir. So her voice has improved, like loudness is improved, and breathiness has reduced after this 2 months of treatment. Recently, we all as a family got viral infection again, so our voices are little hoarse as a
Okay,
family.
means you want to say actual condition is better than this, but because of the infections
Yeah,
like
actual
this.
condition was better a week before. Yeah, yeah, yeah. That's what
Yeah.
I
So
wanted.
anyway, when after treatment she called to family members or relatives, what was their feedback? Because when you voice improves, when you are calling to somebody known person, they also will be recognizing. So what was the feedback? Do you have any experience
Yeah,
about her?
she was able to speak to them very clearly. Yes, no problem on phone calls,
No.
nothing at
So
all.
they were telling that her voice is better, something like that, in comparison to when she had the vocal cord paralysis.
Yeah, yeah, yeah.
Okay. Yes, Archita, just tell something more about yourself because we are live at our YouTube channel, so people can hear you and they can get motivated. And in fact, we'll be continuing some more session. So my idea was that like let's do live, and people will get idea in this many days what we achieved. So yeah, Akshita. So what do you do? Where you study? Just tell something more about in which country you stay, something like that.
Hi, so I live in the Dubai and I study in the Winchester School. I love to read. I've recently read Percy Jackson and Diary of a Wimpy Kid. I am 11 years old. My birthday was on March 11.
Okay, nice. So, what is your career plan? What do you want to become after your studies?
I'd like to become an author or a coder since I love reading.
Okay, so your career plan is to become author. So, what kind of book you like to read?
I usually read like fantasy or realistic fiction.
Okay, something I'm just arranging my videos. It's hiding some faces. Sorry for that. Yeah, no problem. Can you tell any story so that people can hear your voice? Even Thirsty Crow, you remember anything, whatever you like. Any story?
Uh, can I just like read from somewhere?
Your wish. You want to read or you want to speak? I'll prefer speaking. If you remember any story, any movie story, any childhood story your mom has told, grandmom has told.
I'll just read.
Okay, your wish.
Matilda Wormwood's father thinks she's a little scab. Matilda's mother spends all afternoon playing bingo. And Matilda's headmistress, Miss Trunchbull, well, she's the worst of all. She's a big bully who thinks all our pupils are rotten and locks them in the dreaded chokey. As for Matilda, she's an extraordinary little girl with a magical mind.
Yeah, it's okay,
And now
fine.
she's had
No issue. I'll be talking more. Um, so, what are your hobbies? What do you spend your time on Sundays, especially?
I usually like to read and talk with my friends and sometimes draw.
And what kind of food you like to eat?
Spicy food.
And since how long you are in
Like
Dubai?
Huh?
Since how
I've
many
been here
years?
since 3 years.
Okay. So
3
before,
years.
going to Dubai, where you were staying?
I used to live in Mumbai in since like I moved here when I was 7.
Okay. So as I told you, can mute your mic. So as I told in this live, we are going to talk about the post-treatment voice of Akshita that we already did, and we will also playing the pre-treatment voice so that we did, and now why the vocal cord paralysis happened. So the cause of vocal cord paralysis sometime may be a viral infection, sometime bacterial infection, sometimes surgery after thyroidectomy, sometime even I have seen during the cardiac surgery, sometime trauma, and sometime idiopathic. We don't know the reason. And what will happen when the vocal cord will paralyzed? Because here we have larynx. Inside the larynx, we have two string-like structures known as vocal cord. So if the nerve which supply to the vocal cord, we call technically recurrent laryngeal nerve. It is the branch of the vagus nerve, 10th cranial nerve. And when it's get damaged, the nerve impulses will not reach to the vocal cord. And then the movement of the vocal cord will be restricted. So in your case, one vocal cord was paralyzed. So can you tell which vocal cord paralyzed, right or left one?
Left vocal cord.
Yes. Okay. So in case of yours, if left vocal cord paralyzed, when we normally speak, when we say both the vocal cord will come closer together, and there will be very small gap and air will be coming. At the same time, vocal cord will vibrate also. So suppose if left vocal cord is paralyzed, when you are speaking or whenever you are producing the sound, right is coming, but left is not moving. So what is happening? There is a phonatory gap is developing. So lots of air are getting escaped. And because of the escaping of the air, so the air pressure which was supposed to be used to vibrate the vocal cord, so we don't have the sufficient air because of the wastage of air between the two vocal cords. Left is not moving because of the phonatory gap. So what is happening? Amplitude of the vibration of the vocal cord is less. Means was less. After therapy, slightly it has improved, and in fact, I'm expecting more improvement. So amplitude of the vibration of the vocal cord will less because air is getting wasted. So if we'll try to bring the vocal cord, suppose the left vocal cord is paralyzed, and with the voice therapy, if we'll stimulate the vocal cord, left vocal cord, then it will come more closer towards the right one, and the air wastage will reduce, so that the amplitude of the vibration of the vocal cord will increase and breathiness will reduce. There can be situation where we can't move the paralyzed vocal cord. So in that case, what we can do, we can also bring the right vocal cord more closer towards the left one. Then also the air gap will reduce, and then the loudness will improve. So our goal is to improve the voice quality, and it may happen by any means. Either the paralyzed vocal cord will start moving, or even the normal vocal cord will come more closer towards the left one. So of course, this live I am doing little earlier, but my plan is in the future also will doing one more live. And this live was just to motivate people having similar problem. They also can listen your voice pre and post and your mom's feedback, because you developed the viral infection recently, so the voice quality is not good. But my idea was to do this live, and we did it. And so we'll also talk about what we do in online voice therapy. So already I spoke in the exercise will be the same in online and offline. Only the medium of instruction will be different. In offline treatment, what we do, the patient is sitting physically in front of me and I'm giving the instruction. And the same instruction I'll be giving during online treatment also. So, but mode of instruction will be different. That will be by online method, by video calling or video chatting, you know. So the treatment technique will be exactly the same, only the instruction method will be different. Again, what we do in online voice therapy, we try to bring the vocal cord more closer together, and we try to reduce the phonatory gap so that air wastage should reduce, so breathiness will be less, and even the loudness will improve, because amplitude of vibration of the vocal cord will increase, because you will be able to maintain the lot of air pressure because wastage is reducing. So that was the idea. And next was, I was having a plan to talk about what are the other communication disorder services we have at our center. So other communication disorders we have services are the vocal cord paralysis, dysphonia pre and post treatment, and videos you will be able to find at our YouTube channel playlist. Those who are watching this live, if they want to understand what services we have at our center, they can also explore our YouTube channel playlist. And in that, they will find pre and post treatment videos playlist, and that will be having different communication disorder. For example, vocal cord paralysis, high pitch voice puberphonia, stammering, and misarticulation, spasmodic dysphonia, functional dysphonia, and phonatory gap, sulcus vocalis, after stroke aphasia happen. So those kind of playlist, people will be able to find it, and that will give hope for the people having the communication disorder. And In fact, I'm by profession, I'm an audiologist and speech language pathologist both. So at our center, we do hearing testing, we do hearing aid fitting also, hearing aid dispensing. In fact, we have the facility of invisible hearing aid also we fit, and depending upon the hearing loss, and after the like hearing aid fitting, how communication improves, those kind of playlists are also there in our YouTube channel playlist. And next was my plan was how to contact us. To contact us, those who are watching this live, please refer the description of this live or this video. You will find our website. On website, click reach me, and then you will find our email ID, contact number, and on the Google map where is clinic situated. So all the information you will be able to find. And once you will call us, and we'll do the first perceptual evaluation. If needed, we'll suggest certain test, and then accordingly we'll guide you. And that is how to contact us. And the next is treatment duration and treatment cost. So for that treatment duration, I'm giving clue how to know that. Once you explore our YouTube channel playlist, you'll find different communication disorder playlist, and all the videos will be having pre-treatment and post-treatment videos, and I'll be telling date as well. So please explore our YouTube channel playlist, and you will get very good idea about the treatment duration. In fact, for the vocal cord paralysis also, if you want to know about the changes, once you explore our YouTube channel playlist, you'll get better idea. And about the treatment cost, it varies and it depends upon the communication disorder. So on that, we'll be able to comment once we'll listen the patient voice, and we'll do perceptual evaluation. If needed, we'll do certain tests. We'll suggest certain tests once we'll see the report, and then we comment about the treatment cost. So these are the lives just to create awareness among the people having different communication disorder. And I'll see some question if I'm getting. Yeah, there are some people who has joined. I'll be I can see here Dhaval Patel is saying hello sir, hello Dhaval Patel, and Gautam is saying good afternoon sir, good afternoon Gautam, and Shiba Sarkar is saying contact number please. So again, for contact number, please refer the description of this live or this video, and you will find our website. On website, click the reach me, and you will find our contact number and the email ID, and on the Google map where is clinic situated. So all the information you will be able to find. And Shobit Pandey is saying nice sir, thanks Shobit. And the Siva Sarkar is saying online treatment available. So Siva Sarkar, of course, there are some communication disorder for which we provide online voice therapy services. And who is a client for online and who is a client for offline? On that decision we take after the perceptual evaluation. So first you need to call us, and once we listen the voice, then we'll be able to guide you. तो जिन लोगों को हमसे कांटेक्ट करना है, आप लोग हमारे किसी भी वीडियो के डिस्क्रिप्शन में जाइए, आपको हमारा वेबसाइट मिलेगा, वेबसाइट पे क्लिक कीजिए रीच मी, तो आपको मिलेगा हमारा ईमेल आईडी, कांटेक्ट नंबर, गूगल मैप पे क्लिनिक कहाँ पे सिचुएटेड है, सारी जानकारियाँ मिलेंगी, और आप हमें कॉल करेंगे तो आपकी आवाज़ को सुनेंगे, समझेंगे, फिर गाइड कर पाएंगे ट्रीटमेंट ड्यूरेशन के बारे में, एंड जानकारी दे पाएंगे ट्रीटमेंट कॉस्ट के बारे में, हम लोग ऑनलाइन हेल्प करेंगे या ऑफलाइन, या नहीं हेल्प कर पाएंगे या कर पाएंगे, इन सारी चीज़ों के बारे में. और स्टार इज सेइंग हाय सर, हाय स्टार. So thank you everyone for joining us and watching us. Thank you all. Love you all. Thank you so much. We'll stop this live, Akshita. And before that, just tell in 1 or 2 sentences what was the problem, why you contacted, and how do you feel?
Yeah, so the problem was like so first it started with dysphagia, like I couldn't swallow water, and also I couldn't swallow food. That resolved, but my voice still remained low, and it was like very breathy, very hoarse. Now I feel it's louder and it's less breathy.
Okay, so thank you so much, and we will, sorry. Yeah, thank you so much, and we'll stop this live, and thanks for supporting me for creating awareness about the communication disorder, and thanks for coming for live. Thank you so much to you and your mom both. Thank you. And thank you all for watching and joining us. Thank you so much.